My name is Justin Kribs with InsMed Loan Advisory Services. I'll be doing the webinar today. It's a financial beginnings webinar. I'm joined by Joanne, who is the area manager for California, and today's going to be a little different. I'm going to go through some slides, and as we can imagine, when we're talking about goals and tools or creating a financial plan, um, there's only so much you can really talk about. However, I want to spend hopefully the vast majority of the time going through an Excel spreadsheet that I've created and is available to share that actually allows people to develop their own, I would say, mini plan. We'll also be reviewing a few online tools that are available to you so that, if you have questions you want to have answered, like, loan repayments, etc., you'll be able to go online and find those answers. So when you think about, creating a financial plan, there is what an advisor might put together for you. Some advisors, they consider their financial plan to be nothing more than an asset allocation. How do you want to invest my money? Here's your financial plan. Here's your rate of return. See you later. Other people, they focus on things like your cash flow, or they want to talk about your insurance, or there's all these other things that kind of go into a financial plan. But when you kind of break it down to the very basics, it's really about, the cash flows that are going in, the cash flows that are going out, and then assigning money to different goals. So for today, again, the agenda is pretty simple: budgets, online tools, and then Excel 101, which I know a lot of you know how to use Excel. However, there is a Excel document that is available for you to grab. I sent a copy to MedStar. There'll be a copy through Financial Beginnings. I can email to you as well, that we will be reviewing, so you don't have to build your own. And I see that people have found these to be helpful, especially if they're, again, trying to say, hey, I only have a few questions I'm trying to answer for myself, or I'm just trying to figure out, how to make it through this transition, either into fellowship to residency, or the transition into an attending. How do I manage these next few months? So we'll be getting into that. So whenever you sit down with a planner, it's pretty much the same questions. What are your goals? Pretty subjective. I'll have people write their goals for me. Somebody says, hey, Justin, I want to talk to you. Great. What is it you want to talk about? Well, I want to talk about these few things. Great. Of those things that you want to talk about, what are your long-term goals? What are your short-term goals? What are some goals in between? If I'm talking to a medical student, all right, fourth medical student, what's your goal? I want to match. I want to be able to get to my interviews. I want to be able to afford ERAS. I want to be able to afford the move. Um, Today's medical students, they're going to be doing all their interviews electronically. Okay, but they still have to pay money to move. All right, versus a person who is in training already, or a person who is already an attending. Well, those goals have now shifted. It could be things as long term as paying off debt, or I want to buy a home first. What is it that you're trying to do? What is it you're trying to accomplish, and what are your timelines for accomplishing these things? Because as we all know, life is fluid, and we have an infinite number of wants, but we have a finite amount of resources. All right, so how do you allocate? And when I ask people to write down their goals, especially if it's a couple, I want to see both individuals' goals. What things work against each other? One person wants to buy a boat, the other person wants to spend the money on a house. What goals are in, lockstep? Both want to save for college for their kids, or both want to pay off their student loans. So you start looking at the goals and you start prioritizing. And as you start to prioritize, you start going, okay, well, what makes sense now? An idea, of course, is to make sure that whatever goals are set are, are they specific goals? I've had plenty of people I've sat down with where, it's our initial meeting, and they'll spend an hour and a half just trying to get to what it is they're trying to accomplish. They'll talk about everything else going on in their life, which is important, of course, but again, what is it you're trying to accomplish? Go in and see a healthcare practitioner. It's like, all right, hey, my shoulder hurts. I want my shoulder to get better. Very simple. I want to get better. Help me make myself better. That's what I'm talking to the specialist. That's what I'm talking to the healthcare professional. You know how to help me make this feel better. With finance, with individual goals, there's always those internal conflicts. And sometimes, excuse me, it can be hard being specific. So again, what is it that you're trying to accomplish? Measurable. How do you measure success? If you don't see it every day, if you don't feel it every day, how do you measure the success? What do you consider a success? I've had some people say their success is okay. I want to pay off credit cards. Okay, how much is that credit card balance? How much is it going down? Is it a measurable success? Is it attainable? Is it something that we can actually feasibly obtain? You have people such as the FIRE movement, financial independence, retire early. FIRE. All right, I want to retire at age 45. All right, well, how old are you now? I'm 40. How much do you have saved? Nothing. That's your job, right? Well, no, you're supposed to save. I'm going to tell you that you're going to need like 100% return on investment for the next 5 years in order for you to meet that goal. I mean, is it attainable? Now, some people, yeah, it might be. Maybe they have a really, really high paying job, no debt, and they can save up enough to retire. But again, when you talk about that attainable goal, now that I've said the word retirement, okay, well, is your retirement sustainable? People say, I want to retire. Okay, what is retirement to you? All right, well, my idea of retirement is I'm going to sit in front, I want to sit on my porch and stare at mountains all day. All right, that doesn't cost a lot to go sit and stare at mountains. Fine. You don't need very much money in savings to retire with that lifestyle. What does he want to do in retirement? I want to travel the world. Okay, how much is that going to cost? How do you want to travel the world? Oh, it's going to cost me $100,000 a year to travel the world. All right, great. How much do you have saved? $100,000. Is that attainable? Is that realistic? Idea about retirement. Um, Relevant. Is it something that you're really trying to do? I mean, is it something that's relevant to your situation? Is it something that's going to give you meaning? This is again very subjective. For some people, it's extremely relevant that they want to purchase an RV. Like that's what they want. That is their dream. They want to have that land yacht and just drive everywhere. See the US, see Canada, see wherever. That's relevant to them. Is it relevant in terms of, is it something that you want to do now? Is it something that your spouse also wants to do? Um, Really, probably one of the more emotional meetings I was in, it was a retired couple. This one was very early in my career. And I was sitting with my mentor who was their planner, and you had the husband always had a project. His the wife, she wanted to go somewhere. And to him, what was relevant is making sure the house is always in working order, when it's always doing this, there's nothing that they have to worry about. For her, she wanted to get out there and go and spend time together while they still had time. So relevance. Um, Time based. Yeah, time. Okay, well, how long do we have to meet this goal? Do we have the right set of circumstances to meet that goal given the amount of time? Again, saving for retirement, saving for college, paying off college education. If you're going for a pay as you earn discharge, you have enough money saved up to pay the taxes. I mean, what is it that you're trying to accomplish, and how much time do you have available to accomplish that goal? And time is again, it's one of those funny things because people talk in terms of time, but time doesn't feel real when you're living through things. Just like when I talk to a first year medical student, I talk to them like they're already a resident because you don't go to medical school to try it out. You go to graduate. And in some cases, they sit there and go, okay, this isn't relevant to me because it's not the right time. This is too far ahead for me to be worrying about this. That might be so. However, when looking at planning and trying to set realistic, obtainable goals for the future, you have to focus on time and how much time do you have available to actually meet those goals. And if you're not thinking about time, then that's when things catch up with you. I'll worry about that later. I'll worry about that later. I mean, you ignore things long enough, all of a sudden they become a problem. And now that could be counterintuitive, you don't want to worry about things all the time because now it creates stress and anxiety. And it becomes a self-defeating prophecy. I don't want to deal with this now. I'll worry about it later. I don't want to deal with this now. I want to worry about it later. Then later happens. Or if you fixate on it every day, then you feel like you can't accomplish anything else. I see that a lot when I'm talking to people about their loans. They want to pay off their loans and they fixate on that one part of their life and they ignore everything else. And that's when they ignore everything else, other things start popping up, other problems. Oh, I haven't saved for retirement yet because I spent the last 15 years trying to pay off my loans. So time is extremely important. Excuse me. So, I mean, when you're talking about meeting goals, like how do you meet them? Well, they usually come up with two things. I mean, you can save and you can plan. That's what people always talk about. You can save for things and you can plan. All right. Well, again, what are you saving for and what's the plan for your savings? Now, the most common type of plan out there is the budget. And again, this is not a lecture on how to budget because budgets only take you so far. A budget is a snapshot in time. Um, Budgets are extremely fluid. I've had people come in and they spend hours, creating a budget, which is, I'm glad that they took the time to create that exercise. However, a week can pass by and all of a sudden, hey, their job has changed. I mean, look at what we have going on right now, COVID-19, and the impact it's had on so many careers. People could have made these immaculate budgets, and then something happens, and then that budget gets shook up. All of a sudden, that budget is not irrelevant; it's just not as relevant as it used to be. So when I have people come into my office and say, "Okay, hey, I've created a budget," I tell them, say, "No, this is helpful, but I don't expect this really to be your cost of living." Because there's always that, oh yeah, this other thing came up. And especially if you have children, those of us who do have kids, we can make the most immaculate budget in the world. Our kids really don't care what our budget is. They're going to do things and things are going to happen. And then you think you had thought of every contingency, and then kids being the special things that they are have figured out a way to mess that up. That's the way they are. So it's a great exercise to create a snapshot, to create a baseline, but it's not a plan. And I always question people when they say, "Hey, I sat down with my financial planner, we created a budget." I'm like, "Okay, what's the purpose of that budget? What were you trying to obtain? What was the goal you're trying to seek? What is it that what's the point A to point B?" Also, in budgets, you have to think about, okay, what is it that we can control? What we have that sense of control. It's that you know knowing what is going on. I think that's probably, in my opinion, the best part of a budget. That's what a budget kind of gives you. It gives you a snapshot about what is going on, at least at that time. There are no surprises. These are all the bills. These are all the outflows. Here's the inflow. I have a control. I have a sense of control. Like it's not as chaotic. I'll do that something similar again when I deal with a person's loans or other finances. It's always sitting down and say, okay, where is everything? What's going on? What gives you that sense of anxiety about this topic of money? And sometimes it comes down to, they feel like they have a lack of control in certain aspects and they want to create more control. Okay, let's work on that. So the basics of a budget, again, very simple. And when you think about a plan, and if you ever sit down with a planner, you need to look at it in this broad way of things. You have to look at it, okay, what are the inflows? What are the outflows? It's so simple, but also what are the variables that can change that? And if you're working in a position that has a lot of different variables for the income, What is that consistent source of income that you can budget around? And what is that inconsistent sort of what is that inconsistent source of income that you don't really account for in the budget, but it's that extra little windfall that might happen? I never take, for example, tax return refunds. I never assume a refund for a person. I don't care how much they're withholding. I never assume a refund, because as soon as you put a refund into a budget, into a cash flow, as soon as you put an excess source of income in there that doesn't arrive, all of a sudden you have a shortfall, and a shortfall is not a good thing to have. This is where, again, clinics with COVID and some institutions, they're expecting this source of revenue. Yes, they think about contingency plans, business disruption planning, just like household disruptions, but then something that shuts off all sources of income. Well, they're accounting for those sources of income in their budgets. Now that source isn't there, now what? So again, what are those guaranteed sources of income? Now the fixed and variable expenses, of course. We all know, we've been taught these. I think they get kind of ground into us with every financial lecture we ever listen to. You know, your rents, your car payments, things that are your installment payments are fixed. Utilities can be considered fixed, even though those numbers go up and down. Your Verizon bill, that should be fixed unless you have overage charges. Again, kids. So the things that you can expect, and then of course your variables mean, okay, well, what's gas going to cost me, and then what I spend on groceries. What are these little incidentals that pop up that some people try and meticulously budget for, like, oh, I buy one extra cup of coffee every other day, or they get into it like that. But again, that's when people want to have that super control over things. I just want people to have an idea. What do you think it actually costs you to live every month? What do you think it costs you to live? Do you ever feel like you have to put something on a credit card to make it to the next month? That's something I see very common during training. Is I'll have people who are in residency like, yeah, I have a shortfall of $500 a month. I have to put that on the credit card. And then you say, okay, well, let's dig into that. Why is that? It could be very, of course, situational. I have people who have matched to UCSF or to, Mount Sinai in New York, or, all these really expensive places to live, where it's not uncommon for somebody to come out with some sort of credit card debt after training. Once somebody becomes an attending and that income supposedly should go up, do you see a reversal of those habits? So again, income, gifted income, loaned income, portfolio income being your invested assets. And portfolio income is really what you live off of in retirement. When I say retirement and your savings, that's what it is. That's what's giving you the income. You have no more work, theoretically, unless you're consulting. You're not really being gifted anything, typically in retirement. It's all here. Versus while you're working, it's all earned. I mean, think about it. When we're kids, it's gifted. Like, how much money are our parents giving us as an allowance? You're working, it's earned. Retirement is portfolio. Now, it might be a combination of things depending on where you are in life, but that's typically how it goes. So you're earning to create your portfolio income, which then you'll utilize in retirement. So I know we went over this slide earlier, but when you're looking at, again, your income, creating that budget, it's always about, okay, we have our net inflows, which you get from your net paycheck. You have your deductions. This is what's going pre-tax into retirement. Here's what's going out for taxes. I don't expect ever to get anything back from this. Here's what I'm paying out as a monthly fee to, help manage risk, or whatever it is you have your after-tax deductions for. This is the number that you live off of. I have literally seen people come into my office with a financial plan. I was prepared for them, where the planner, and I use that term lightly, made their budget, made their plan around their gross income number. They literally said, oh, you make $120,000 a year, you have a $10,000 a month budget. Now allocate that $10,000 and here's your investments and here's this and here's that. And it blew up right there. I literally asked him one question, which was, where the taxes go? And then it went, okay, well, let's take this nice piece of paper that you just received. Let's set it to the side as how it might look in the future if your income goes up. So again, it all starts with that paycheck. What's that income? What's going in? Of course, the expenses, fixed, variable. We can look at these as fixed expenses if you want to base your budget on your gross income. No, we have the taxes, we have our after-tax deductions. Variable, of course, whatever that variability might be. Is it that you have your meals that are paid for by your institution, but because of COVID-19, now they're no longer paid for by your institution? Needs and wants. That always starts a big debate. Again, going back to if you're in a relationship, you have needs and wants, and everyone has a different opinion about what those are. And the purpose of this slide is saying, okay, well, what is it you really need, and do you need that in the budget? Versus a want that you can kind of eliminate from the budget and use for something else. Like, I keep using this example of coffee because this was literally the information that some students receive at other institutions. They always go into the coffee talk. Do you really need that extra cup of coffee, or is it a cup of coffee that you want? Well, I think depending on what your week was like or what your day was like, you might really need that cup of coffee to make it through. You might really need that massage. You might need something to actually help you make it to that next day. And when I talk to people, especially when they're in high stress jobs or in high stress curriculums, I knew as a counselor that my lectures were not helping a person pass their board exams. It wasn't going to help them pass their shelf. It wasn't. I was not part of their didactic learning. I was literally a support system for them. And I always tell them, hey, if you need that cup of coffee to make it through that next day, or if you need that massage, or if you need that CrossFit class to de-stress, that's a need. That's not a want. Behavioral health and thinking about your wellness as being this bigger picture than just money or well-being internally. You start kind of blurring those lines. And the way I always look at it is, yeah, there's that financial cost to it. But if you understand that financial cost and it's something that you're okay with, all right. Are we going further into debt? No. Fine. I would rather have you spend X amount of dollars on a workout class than have you remediate another year. I'd rather have an attending have that extra massage or pay for a counselor if that's what they need to do to make it through a high stress position. So needs and wants, again, it gets very subjective. But you start to understand, like, if it's not something that you're utilizing, maybe it is just a want versus a need. All right. As with anything, income, expenses. And this is where, I always find it interesting when institutions have you teach classes on budgeting, and yet you'll have some of these same institutions having issues with this exact same problem, which is, do you have a net operating loss or net income? And I always tell people, what is it that your end savings goal is? And if you want to have that net income, of course, then you either increase this or you decrease that. Very simple. Cutting expenses, we already talked about that. I'm sorry if I'm going through these slides really quickly because I want to get to the Excel file to actually start showing people actually how to create that plan. Cutting comes down, again, in my opinion, to utilization. Is it something that you utilize? Is it worth the expense? What is it? YouTube TV, for example. I cut the cord a while ago. I started using all the online services that are out there: Hulu, Netflix, YouTube TV. Didn't watch a lot of TV, and quite honestly, I can care less if it's a rerun. If I'm feeling like it, I'll watch it. And I had access to news, and I have my subscriptions online to for news and my podcast. I felt connected. Now Netflix or YouTube TV wants to increase prices to $65. All right, is that something I can cut? Can I get that information? Can I get that content elsewhere? It makes you automatically think, okay, where can I get that somewhere else? There are things that, of course, we need to use, but like cutting expenses could be anywhere. Like, can you go with a generic brand? I mean, there are some really chintzy ways to cut expenses, but again, when you look at your lifestyle, is your lifestyle in your needs and wants creating an undue burden on yourself? Yes or no? Do making changes help you meet your other goals? Because if I have something else that I want to do, I will cut expenses in order to meet that goal. Otherwise, do I need to cut those expenses to meet that goal? So, of course, they always talk about budget busters, and this is what kids. Kids are budget busters. Accidents, layoffs, pandemics. You can drive yourself crazy thinking about all the what if scenarios that are out there. Excuse me. But are you creating a better plan by worrying about all the what ifs? You hear people like, I believe it's Dave Ramsey, will say, hey, have $1,000 emergency budget. Okay, how far is that going to go? You'll have myself, I believe, in a year's worth of cash and savings. You'll have people look at me and say, that's crazy because you're young, you should be investing all that money. I'm like, yeah, I'm young, but I also have kids. And my kids really don't care what my investments are doing. My kids care that there is a roof over their head. And if my wife and I both lost our jobs, I want to make sure I can pay the mortgage. You know, you can think about all the unexpected all the time. And this is where, again, people can kind of, you know, you can't see the forest through the trees, sort of say. You get so fixated. I'll have engineering clients that will be really fixated on the littlest detail, not thinking about how that one little detail affects all the other dominoes. So budget busters, yeah, you have to be aware of them. You can think of them in terms of your lifestyle. Like, gosh, I have this really expensive, at a client that a really expensive RV plane habit. I wouldn't say habit, hobby. His spouse would argue that it was a hobby, but he loved his radio controlled planes. And they didn't have the money in the budget for the plane to go through the window of the house, but it happened. Again, budget busters, unexpected. It can be as simple, and then you hear about all these just crazy stories about things that happen, and you can worry yourself to death, or you can say, okay, here's what possible financial costs of things if they happen. What does it cost to actually prepare for those things? Insurance is one of those things. You buy insurance so in case something happens, it doesn't break the budget. So keeping track of things, yeah, there's lots of tools out there. We're going to focus on, where's my mouse, this today. I've had people use Mint. I've had people use YNAB. There's all these other tools and programs and things. I mean, you can go nuts getting downloaded apps on your phone that track everything that help you. I mean, apps, what they help you spend money, they help you save money. What works for you. And really, that's what it really comes down to, what works for you. So as you're looking at responsibility, as you're looking at everything, yeah, you have to analyze what's going on. You have to look at everything that's happening. You have to think about, okay, what is it you're trying to create? What plan is it you're trying to make? And then how is it that you're going to get there? How is it that you adjust? And so let's get into the Excel. Now, hopefully, everyone can see that. All right, and feel free to comment if you can't. So this is the Excel file that everyone can get. And it's very simple Excel. If you're trying to build any sort of mini plan, a lot of it can be done in Excel. A lot of financial planning software that is out there, um, Right Capital, uh, Morningstar, Principia, all these financial planning software uh, programs that are out there, they're all based on Excel. They're just fancier. They have a lot of extra features that are built into them, such as asset allocations, which we'll show here, and they create a nice printout. Now, keeping this in mind, as you're creating a plan, just always know that the plan should be flexible. That's one thing I love about Excel. That's one thing I love about working with Excel is that you can get as detailed or as minimalistic as you want. So basic here is the budget. And I have this here for really my engineering clients, for clients that are extremely fixated on getting every last detail, accounting for every last penny. And the funny thing is, they can never find every last penny because something always happens. This right here is I created to help people understand. I would always be asked, okay, well, if we shave this part off the budget, what is that savings long term? And I've had people utilize this within a household to say, okay, if we cut this and we saved it, what will that net us versus if we cut that and saved it? And this feature right here is a time value of money. It's a future value calculation. The whole idea, and then the ribbon is right here. When a planner or advisor, anyone does a future value calculation, they're looking at present value numbers. What's that payment? So what's that savings going to be in the budget? Look at rate of return for that savings. Like if you're going to take money from somewhere and put it somewhere else, is it going to have a return on investment? How long are you going to do that for? And then what's that going to be in the future? And when people say, okay, well, if I want to save $100 a month for my budget, how much would that save me over a year if I had a 4% rate of return? This is really a very simple tool. So as people create a budget and as they are trying to massage their budget and say, okay, how can I squeeze out an extra few $100s here or a few dollars there? And if I squeeze that money out, where can I put it? Well, this is one way of doing that. I'll do a similar exercise with people who want to reduce their loan payments. Okay, they're having $1,000 a month payment. COVID-19, the CARES Act happened. They have their payments turned off until October. Okay, they're going to give you, 6 months off, and you have $1,000. How much can you save? All right, is that enough, or do you need a better return on investment? That's really what this is doing. It's a very simple future value calculation. It leads into when people are trying to do savings during training. Okay, well, if I'm going to have a rate of return at 5% and inflation of 3%, and if I'm saving money during by PGY 1 year through PGY 5 or however long your training might be, you can literally just copy paste these cells. How much can I save at the end of training? In this case right here, the person started with $100 a month and just kept increasing that savings. This is what they can save after 5 years. Now, this can be during training. This could be even as an attending. How much are you saving? This right here, this spreadsheet, is just a little bit more complex spreadsheet compared to this one. This is just one period of time. This is multiple periods of time. Then when you get to retirement, when people start talking about, okay, how do you save for retirement? Change the view. The steps are very simple. And this is, when you talk to a planner, this is all they're doing. How old are you now? When do you want to retire? When do you think you're going to die? Little heads up, every financial plan software out there has people die at age 100. You can kind of finagle that a little bit, but when a advisor is running a financial plan for a person, they're saying, okay, you're going to die at age 100. What you're doing here is just saying, okay, how much money do you think you'll need every year in retirement? And this is where you hear the crazy numbers like, oh, you'll need 80% of salary in retirement. Okay, so you think to yourself, I make $150,000 a year or whatever the number might be, and 80%. Okay, I need $120,000 a year when I retire. Oh my goodness, what's that going to mean? That means that in this case, for this person who is at age 30, wants to retire at age 65, they need to have $7.5 million in savings by age 65. They will live for 35 years during retirement. And if life is a spreadsheet, they need to save $67,000 a year for them to retire. That's when you run a retirement projection. This is as simple as it gets in terms of the calculations involved. This is not taking into account things like Social Security. This is not taking into account, again, what future lifestyle might be like. This is why, again, I feel that when people start talking about in terms of retirement and in terms of, okay, retirement expectations, and when you hear these numbers of, oh, 80% of this, 70% of that, 60%, it's all very subjective. It's very easy for every advisor out there to say 80% of income at retirement. It doesn't seem so dire in terms of savings when you say, okay, well, hey, your house is paid off, your loans are paid off, you have money in your health savings account, you have all these other things saved up. Um, you just want to sit and stare at the mountains, and it's going to cost you $3,000 a month to do that. All right, well, great. You need to save $20,000 a year, which is very easily doable, especially if you're putting money into a retirement account. Numbers change, but again, that's when you look at how you grow from just creating a budget to looking at how changes in your budget equate to future savings over time, which can equate to future savings over a period of time. And again, you don't have to just call this PGY. You can call this, you know, year 1 through 5. It doesn't matter. It's just labeled because I'll use this when I'm talking to residents. And then what is it that going to look like when you go into retirement? So again, different periods of time. So in terms of creating that spreadsheet about retirement and savings, you can find these exact same calculators online. USA Today savings calculator, Investopedia savings calculator, um, a lot of online tools that you can then go back and compare to your Excel file. And in fact, you can create your own mini plans just by using free online software and tools. And then just compiling what questions do you have, getting some of those answers online and printing the pages. Because what is a financial plan? A financial plan is printed pages of Excel documents with a write-up analysis by the person who ran the numbers. Now, where I really get into things with people is the cash flow, and this is something that not a lot of people do. You can say life and living, which always pull from the budget. What does it cost for you to live? So I'll have a person say, okay, it costs me $3,000 a month to live. It can go up, it can go down, but typically $3,000. They get that number maybe from their budget or maybe from the fact that they earn $3,500 a month. They're putting $500 a month into savings. They're not accumulating any extra debt. Well, it costs me about $3,000 a month. I mean, you can kind of wing it like that. I know it doesn't sound very technical, but it's very practical. What I like to do is I always say, okay, what do the next 12 months look like? Is there anything coming up that we need to plan for? What is it that you assume your income is going to be? Drag that out. Okay, well, let's put it in this perspective. Let's say this person here, they have, according to this spreadsheet, a $12,000 budget surplus after a year. Very simple math, $4,000 a month, $3,000 a month of expenses, $12,000 surplus. This is where you can go in and say, all right, well, I know that I want to have a vacation during the summer. Do I have enough money in savings when that happens? I'm negative for this month, but I have plenty of savings, so I'm not negative down here. Oh, and by the way, I get paid, let's say you get paid 3 times in the month of July. $2,000. All of a sudden, it allows you to kind of project out, okay, what does this year look like? So you went from a very small snapshot in time, taken that snapshot in time, brought it forward 12 months, went to your income, carry that forward 12 months, looked at what is it that might happen during this period of time that you need to plan for. It's not part of your monthly budget, but you know it's going to happen. Is it a move? Is it you're going to take time off as you're getting credentialed for your new job? I mean, what is it you have to plan for? Are you going to be on Cobra? What is it that's going to happen in the future that you can then plan for and see, okay, is there a net gain or loss at the end of the year? This again is why I don't like using tax refunds, because you might get a tax refund in April or in July because this month is tax month because of the CARES Act. You never account for that, but you can have it as a cash surplus at the end. So kind of a one small portion of time and then carry it out. Now, amortization charts, very basic in terms of if you're trying to figure out, okay, mortgages and car payments, student loan payments. So this is built. You say, well, this cash flow shows that I have about $1,000 a month left over. After vacation, I have $10,000 a month. If I wanted to, I could probably make an extra payment on my federal loans. Of $500 a month. Still have a cash surplus. You can go back and say, all right, well, let's say that you have a car payment. This is exact same type of functions or inputs that are being put in here. Interest rate, time, amount, just the same as here, the exact same factors, but you're trying to figure out a different number. In this case, you're trying to figure out your payment. But now you're looking at from your budget going, all right, well, it's not a 30-year car loan. This is a 5-year car loan, 3%. Here's my cost of interest right there. So what if, and let's change this to, what are we? We are now 7/1/20, which is kind of crazy. I'm sorry, I did not put in the function to make it automatically calculate the month. It's just really putting in the next 3 months and then carrying it down. Now this is a 30-year mortgage calculator. I mean, it goes for a long time. You can use this for, again, a mortgage, car payment, you name it. This can be part of your plan. And you can put in saying, all right, well, I have that extra payment. Actually put that number right in there. Do that for 12 months. Make sure we line up there. All right, well, how much will this loan cost me? Now that I have it paid off, how many months does it take off my payment? Well, before then, it was a 60-month loan payment. It's actually saved me 13 payments in the future. All right, so total out of pocket savings We go here, get rid of these. Total pocket 32,343. Add this back in. 32 minus 25. That saved you $6,759. So putting in $6,000 saved you $759 overall. So you're able to actually mess with this and say, okay, what is it, how much of an extra payment do I have to make to actually pay something off quicker? You can do a lot of functionality with this. I mean, again, if you're looking to, let's say you're in the market for a home. All right, well, want to buy a $400,000 home at whatever the interest rates are today for a mortgage. Here's your principal and interest payment right there. Doesn't include taxes or insurance, but if you're looking at saying, okay, can I budget for that future home purchase? Well, I mean, going back again to your cash flow. Can you increase your cash outflow by $2,000? Yes or no? Does this get negative? So again, one begets the next. Always creating that next step by looking at how the numbers stack up. So we have an amortization calculator. So in this mini plan program, a budget, future savings, if you change budgets, how much you can expect to save over a period of time, how much you have to save if you were trying to save for retirement. What does a cash flow look like? You can do this year by year. I've had clients where they just sit here and go, okay, well, here's our Excel model for 2020. Let's look at our Excel model for 2021. Amortization chart. Then you have what we call a balance sheet, which is simply just putting everything that you own or invested or you have in savings and everything that you owe. It's a personal balance sheet. And I have asked so many times for a person to come into my office or meet me online or wherever it is and say, oh, complete a balance sheet for you and I have it attached. And they sit there and they go, okay, what is it I'm supposed to put on this? Well, again, you're trying to get an idea. You're trying to create a picture, a visualization of what is it that you own and what is it that you owe. Do you have, $5,000 in savings, and then do you have a mortgage at 350, and is your home worth 400? Just to throw out numbers. Do you have more assets than you have debt? Of course, depending on where you are in your career, that's going to change. But the idea would be you just copy this sheet for every year and you track your progress. You can come in here and say, all right, this is what it looked like at the end of 2019 or 2020. You can go back and look. I've had people do this. You go back and look at your historical statements. Go back to your lender, go back to your financial institution. Can you give me my statement for, or pull it up online? What was my account balance December 31st, 2019? You can actually backfill these multiple years and it can show growth over time. And if you're trying to judge success or failure, you have to be able to compare it to something. What is your control factor? Just like when you're doing an experiment, when you have your hypothesis. If we make these changes in our behavior, we will see a positive progression towards our goals. All right, what was that change in behavior? What is our control? What was your financial status at that point in time? All right, so asset and liabilities 2018. What did it look like in 2019? What did it look like in 2020? We had our money managed by, ABC. It did this, it grew just fine. We went to, money manager XYZ and it went backwards. All right, well, you have your control. Where were you? And who gave you the best return? These, I think, are phenomenal tools. Again, part of any financial planning software that is out there, they have a balance sheet. Right Capital, one of the softwares that we use, there's a balance sheet. All right, well, here's a balance sheet already built in Excel. Use it or not, completely up to you. The last one is an income. And this one, again, you talk about tying it together. We can go all the way back here. Let's actually just move it here. Outflows, inflows to your cash flow, to how has it affected your household at the end of a period of time. 1, 2, 3, 4. 4 spreadsheets. And it really is a financial plan in terms of a household budget. Then it's just filling in the other pieces, who is going to be your tax advisor? Who's doing your insurance and risk management? Who's doing your legal? Who's doing your estate planning to make sure those pieces are in place? Are you using a third-party investment manager? Where do they fit into all of this that you have going on? So because you've created your framework, you have your pillars already in place. But now it's actually taking all these pillars and putting it into action. Actually, doing something with it. Because again, think about like patient interactions. You could talk to a patient until you're blue in the face if they're not going to do what you're going to tell them to do. Yeah, here's your care plan. Did he do it? No. I've had people leave primary care because they were tired of seeing patients come in that were not getting better because they refused to take on the treatments that were prescribed. I'm sure that happens in all fields. Even in my field, I still love planning, even though I will still consistently say the same things to the same people and hoping that next time they made positive step forward. Did they change that behavior? Did they actually create a cash flow? This is also one of the reasons why I don't believe in there's no such thing as a $5,000 or $10,000, $15,000 plan. There just isn't. Because you think about how much time you can put into creating this. Think about your own time. You sunk into creating these spreadsheets. And then one thing changes. Is that $5,000 plan still worth $5,000? I've seen a lot of those, and that's one thing I always like to educate people on. And being that this is our last webinar, I'll leave you with this, and we'll go into our questions if there are any. If not, then again, thank you for being with us tonight. But when you're looking to create a plan, always know that that plan is just based off of specific variables that are assumed to never change in the future. With any plan, you always have to go back, revisit it, change it, and make sure it adapts to your life. You can never go into something assuming that your plan will carry on into perpetuity. That's why I never believe in the $5,000 plan. And I see a lot of those, and I bring that up because that's usually the number that I see. Your plan will cost you X amount of money, and it will save you this much. You're going to make savings regardless of what you do. Just know that that plan is only for a small period of time. Versus, again, these Excels, you can use until you're blue in the face, and they'll adapt to your situation. And you can change, these are not locked. You can change these as much as you want. So anyhow, budgeting and tools. That is our very last course. Any questions at all? And I'm going to move this down here so I can actually look at the camera as I'm talking. Perfect. I don't see any questions popping up. So, gosh, thank you everybody for your time during this series. Thank you everybody for your time this evening. Hopefully you'll find this tool useful as you uh, download it. It should be made available to you here. If not, then you know people at Financial Beginnings and MedStar know how to get a hold of me, so we'll be able to get back in touch with you. So that's strange. My screen just started drawing lines through it, but thank you again. Will it be mail? Oh, you should be able to get something through email. If not, then we'll be able to. Oh, one question: how do you find a financial planner? So that's a good question. So financial planner is not a regulated term. Just to throw that out there, anyone can call themselves a financial planner. It is the process that they utilize that determines if they actually do financial planning. Finding someone is, gosh, it's hard. And I'm extremely opinionated myself. All right, where do you find a financial plan where you don't spend one half of your budget for the information? I love that. That's awesome. Sorry, that was good. Um, all right, so there's two types that are out there. All right, you have commission based, so you have a broker. A broker is a person who they make their money based off commissions. Yeah, the spreadsheets will be via email. Sorry, multiple questions here. So yes, you can get them via email. You don't have to email me for them if you don't want to. You can if you do. I also have provided them to MedStar, and I've also sent a copy of the spreadsheet to Financial Beginnings. So there'll be multiple areas where you can get a hold of the spreadsheets. Um, Also, sorry, hopefully that answered your question. So you can definitely get these. I made them available on both to all parties. And then I wasn't sure if it would, sorry, words in the day. I wasn't sure if it would be too big of a file to share online today. Also, respecting everyone's privacy, I'm not asking for people's emails to send it out, etc. So you can definitely get the emails depending on how you want to go about getting it. Regarding finding a financial planner, that is an extremely difficult thing to do, in my opinion, because there are so many people who hold themselves out there as a financial planner. Um, Word of mouth can work. I think that White Coat Investor has some great articles about how to find a financial planner. I always look at it like this: you always steer clear of people who say they are a doctor expert or a dentist expert or this expert. It's just marketing. There's no such thing as a certified medical professional planner. I've worked in academia. I've worked around physicians for almost a decade now, internally at a university and externally. I would never call myself a physician expert. I understand the training track. I understand some of the things that are going on, but I'm not an expert. I'm not a doctor. Also, how I plan the financial planning process to a person is the same regardless of what your profession is. There's just different circumstances that are involved. You also look at a person who, how is it that they treat their staff? That's incredibly important because it's typically the staff that is inputting all the data. Now, if they have a large staff in a large office, who's actually doing the work versus a person who might be by themselves? Well, at least you know that person's actually doing all the work involved in the plan. But then you have to think to yourself, like, if that person's by themselves, then how many people can they actually administer? I always look at it in terms of how quickly or how interested are they in learning about you? And that's where I can sometimes steer people clear of me and turn people off because I really care a lot about what is it that's going on in your situation. The last question that you should always ask a person, the most irrelevant question out there is, how much money do you have available to invest? Irrelevant. If a person does not have realistic goals, expectations, if a person has no handle on anything else in their life, the last thing you should care about is how much money they have to invest. That's why you have people say, okay, my minimum investment amount is $2 million. But if you're a certain professional, I'll work with you. I'll give you some of my time. No, you're here to help me. And that's one of the first things I look at is like, okay, how much time is it? Like their questionnaires that they provide to you, and hopefully they provide you questionnaires other than your risk. How many of those questions are about you? Portfolio management is something completely different from financial planning. We look here, asset allocation. That's not a plan. That how does this help anybody make any sort of um, decision other than where to put your money? It doesn't. And I've had people have I've worked my first job that I had in finance was the advisor. His whole thing was he would do an asset allocation. Here's your financial plan. I'm gonna get you a 10% return on investment. So I always look at is a person fee based? I don't want a commission. I don't want you to earn your money based on how much money I invest with you. Also, how much is that fee? Is it realistic? So think about the hours put in. I've met advisors out there who their minimum fee is $15,000 a year. Why? So looking at, okay, what's the fee? What's the structure of the business? Are they a broker? How long have they been in the business? That's excuse me as we go here. That's just broker check. That's going on here and finding out what is a person's background. Have they been sued? It can take a lot of time to actually figure that out. And sorry, I know that was a long answer, but it's not easy. I always tell people again, why co-investor, read the articles about how to find a planner, see what it is you want to do for yourself. What holes in the plan that you're making for yourself can this person fill for you? And is it something where you're looking for a long-term engagement, or is it just to get a few answers to your questions and move on? And some people, that's all they need. You have everything going on that's perfect. You just need this one question answered, and that's it. Great. You shouldn't have to pay $15,000 a year to get one question answered. That one question might take some time to come up with an answer for you, but not for a full fee. Long answer to all that. Any other questions? I don't see any others popping up. Okay. Well, again, thank you, everybody, and have a wonderful 4th of July weekend. Stay safe, stay healthy, and thank you again for your time for these last several weeks. Take care.